Diabetes is a serious chronic lifestyle disease affecting millions of people over the world and continues to increase. Diabetes affects how your body turns food into energy. It is a disease in which your blood glucose or blood sugar levels are too high, and glucose comes from the food you eat. Insulin is a hormone that helps the glucose get into your cells to give energy. Sometimes your body doesn't make enough or any at all, doesn't make any insulin, and so it doesn't use the insulin well. Glucose then stays in your blood and doesn't reach your cells. Over time, having too much glucose in your blood can cause complications. Example, situations with the kidney, heart disease, and so on. Although diabetes has no cure, there are steps you can take to manage your diabetes and stay healthy.
It is through lifestyle that we manage the risk of diabetes. Those behaviors include increased physical activity, a healthy diet, routine health checks, and strict adherence to medication. The ministry will be championing the cause of persons living with diabetes. We have updated our clinical management guidelines, which is now available on our website, and we will be working on increasing access to testing through the introduction of point-of-care testing. This methodology of testing is the gold standard for monitoring and control of diabetes. Our agency, the National Health Fund, will continue to support persons through the provision of diabetic medication and supplies, and I encourage persons with diabetes to enroll in the NHF card program to access this benefit.
The person with diabetes should really have an opportunity to sit down with a trained clinician who is able to help them to understand the concepts of diabetes self-management, education, and support. There are 4 core areas the patient must begin to understand. How and when to take medication. That's the first one. If you take insulin, then you need to know how does your insulin work and how do you eat in relation to the insulin. Then there are the people who have type 2 diabetes, which commonly start off with education on activity and just healthy nutrition. And then we add 1 of 5 classes of oral agents. And then we teach them how to make food, how to eat food. Also, we think of things like target blood pressure. Is your weight healthy, or do you need to lose a little weight? And most importantly, how do you feel? What is your quality of life? All of this is what we focus on. Also, when you get your lab work done, what is your hemoglobin A1C? The target should be 7% or less. Keep that number in your mind. Diabetes damages the feet, the kidney, and the eyes at first, and then eventually we also find it can cause coronary vascular disease too. But for foot care, the person with diabetes every day, you wash your feet, wash them properly. Dry your feet, dry between the toes. Moisturize your feet, but do not put moisturizer between the toes. Make sure that you wear cotton socks, right? If you're going to have your toes cut by somebody trained who knows how to cut them. Examine your feet every day. Do not walk barefoot. Please, please, please do not walk barefooted, because if you injure or cause trauma to the feet, you may not feel it because your diabetes has damaged the nerves to the feet. And finally, when you buy shoes that are comfortable and that you can wear without causing blisters or trauma to the feet. Now we have research that shows that I can prevent the eye damage, the kidney damage, the foot damage, and the amputations by just keeping my blood glucoses under control and taking care of myself.
no such thing as a diabetic diet, but it's all about how much I eat, the timing of my meals. So it's your portion sizes is what is important. Now, what we do recommend is that persons eat at least 3 balanced meals per day and small snacks. Snacks usually mean smaller, more nourishing meals, which we usually recommend that it be your fruits, your vegetables, or you can also use your nuts. Each meal or snack should contain protein because we need it to be balanced as well. Each meal should contain at least your protein and your fat. And we also want them to select a variety of foods from all the food groups. So there is some recommendations about the amount of fruits that you should eat per day. We usually say 2 to 3 servings. We want you to include a variety of vegetables daily. We also want you to include more peas, beans, and nuts in your daily meals. Reduce your intake of salty and processed foods, and to reduce your intake of fats and oils, and that of sugary foods and drinks. You aim for foods that have high sources of fiber, such as your whole wheat bread, whole grain rice, flour, more of your ground provisions. They will give you fiber, right? And that will slow down the rate at which your body breaks down the food, so you won't have a rapid increase in your blood sugar levels versus if you eat foods that are low in these added fibers. When you're having alcohol as a person living with diabetes is not to have it on an empty stomach, because it gives the risk of lowering your blood sugar. And also what we want you to do is that once you have diabetes, we do not really recommend the mixed drinks, so as to say, because they usually have a sweetened base. For women, it's usually you can have a drink per day, and for men is no more than 2 drinks. And what is a drink? Usually for beer, it's not more than 12 ounces. And for like a shot, is usually a shot, which is about 1.5 ounces. And for wine, recommendation is usually about 5 ounces thereabout.
There are several researches that have shown that physical activity, when done properly, for persons who are diabetic, again, you heard it, allows you to use up glucose. For children, the recommendation is at least 60 minutes, 5 days a week of moderate to vigorous activity, and it must be a combination of muscle and bone strengthening activity. That's the recommendation for our children. For adults, it's at least 30 minutes, 5 days a week to get some health benefit, meaning increase circulation, reduce stress. And for the elderly, it's at least 30 minutes, 5 days a week. If you're a diabetic patient, these are some of the activities that are very good for you. Swimming, jogging, dancing, these activities, they're not very vigorous. You maintain them at a low to moderate pace, and it's a very effective way of managing and controlling your blood glucose or your blood sugar. If you are going to start a physical activity program, that you check with your doctor before you start, because if you have a condition, if you're diabetic, hypertensive, you have any other medical condition, your doctor will determine the intensity level, the type of activities that you can do.
Persons living with diabetes mellitus have multiple psychosocial issues related to diabetes management and its complications even before COVID. And there's an entity called diabetic distress, which refers to the negative emotions such as feeling hopeless, angry, or frustrated that persons who are diagnosed with diabetes experience, especially if they lack social support. I must mention we have the mental health helpline, which is 888-639-5433, or simply remember 888-NEW-LIFE, which is a 24-hour, 7 days per week psychological support produced by psychologists. When you call this number, they can provide emotional support for you. If you are feeling any form of emotional distress, they can provide support for you, and where you need additional help, they will direct you to additional help.